Hi, I'm Justin Riley. Today on Wisconsin Doctors, there's a brand new clinic that opened up right here in Mount Horeb. It's the Mount Horeb Clinic for the Upland Hills Health System, and it's right here on Springdale Street in the North Cape Suites, right next to the Farmers Savings Bank. And we're going to be talking to a couple of different family medicine providers. One of them just started here at Upland Hills Health Mount Horeb Clinic. It's Dr. Joseph Berg. Dr. Berg got his education from Des Moines University and also did his residency there, and he's going to be talking to us a little bit about the difference between urban healthcare and rural healthcare. We'll also be joined by Dr. Rachel Hartline, who is set to start very soon at the Spring Green Clinic for Upland Hills Health, and she's going to talk to us a little bit about global medicine and why she chose to do family medicine. It's all coming up right here on Wisconsin Doctors. Stick around. Welcome back to Wisconsin Doctors, and we are so excited to be here on location at the brand new Mount Horeb Clinic, part of Upland Hills Health, right here in Mount Horeb. And my first guest is Dr. Joseph Berg from Family Medicine here. Dr. Berg, welcome.
Thank you.
Yeah, good to be here. Good to have you on our program. So, obviously, you just started seeing patients in this brand new facility. I mean, when exactly did you start?
Well, yeah, I started being on call in the hospital on the last weekend of July, and I started seeing patients the first week of August.
Okay, yeah. Cool. So you're brand new. This is a brand new thing for you.
Brand new for me.
Yeah, awesome,
great.
Awesome. And it's been going pretty well?
It's going fantastic, yeah.
Yeah.
Really enjoying the new clinic, and patients have all been great. And
that's awesome.
Fun. Yeah.
That's awesome. Are you originally from the area?
I'm not. I'm from Onalaska, Wisconsin, which is a smaller town just north of La Crosse, Wisconsin.
Sure.
Yeah.
Oh, welcome. We're glad to have you here.
Thank you.
Yeah. So patients might be interested to know, like, what services do you provide, and like who would be an appropriate patient for you to see?
Yeah, so I'm like they already said, I'm a family practice doctor. So I see males and females, men and women of all ages, and I perform pretty much anything they need. I can deal with your blood pressure. I can do a well-child check. I can take off a mole. A lot of different services.
Yeah, broad spectrum of different services.
Right, exactly.
Awesome, awesome. So what about babies? I mean, do you do any delivery of babies or anything?
I don't deliver babies. I do prenatal care. So if one of my patients would get pregnant, I could see them up to about 36 weeks in pregnancy. And then we have a really great obstetrician who works here, Dr. Maria Sangren, and she would be able to take care of the patient from there on to delivery, and then once they're in the hospital, I can take care of the baby and even the mom in the hospital. So,
and we've had Dr. Sangren on our show a couple of times now, and she strikes me as somebody who just really knows her stuff really well.
Right.
So do you get to work? I mean, do you collaborate directly with her at all? I mean, do you see her on a regular basis?
Yeah. She's right down the hall. So if I have a question, I can
she's
just
here.
Pop into her office and see if she has any opinions. And she's asked me for stuff, which has been fun.
Yeah. It's always good to have good colleagues to collaborate with.
Exactly.
Yeah. How are you liking living in Mount Horeb? How's the community treating you?
It's great. We just bought a house. It was my wife and I's first house, so that's exciting.
Nice.
We're around the corner from the clinic, which is convenient, and the community's great. It's a lot of young families, a lot of really nice people. We've been welcomed really well. We've had a lot of little small town moments where we meet people that already know us, but it's kind of odd. We've enjoyed like going to restaurants and checking out like parks around the area, and my wife has really loved the library and taken our little daughter there a bunch. So it's been great.
Great place to live, great place to visit too.
Exactly.
So now you're from Onalaska originally, and where did you practice before you came here?
So I just finished my residency program in Des Moines, Iowa.
Oh wow, okay. And how was that?
That was fun.
Yeah.
That was a great experience.
Is that a little bit different? Des Moines, Iowa, is that a little bit different from Mount Horeb, or the types of things that you're seeing here?
I would say yes. I trained at the county hospital in Des Moines. So I saw mostly underserved and poor and uninsured patients. So it was a lot different than here.
Yeah, it's more heavily urban over there.
Yes, it was an urban hospital, but it was a smaller hospital in a big city. So
Sure.
we had less beds, and the residents were kind of the only doctors really in the hospital most of the time. So I had a lot of experience, and worked pretty hard.
Yeah, you got to get a chance to get your hands dirty. And so
Exactly,
forth. So,
exactly.
Yeah, well, very cool. So what do you see? Obviously, you've had some chance to work here for just a very short period now, but what do you see, for the future of this clinic? I mean, what are your thoughts and opinions and so forth?
I think the clinic is just a great opportunity for Mount Horeb. I think Upland Hills did some studies before they opened the clinic and saw there was definitely a need for primary care here. So we've definitely seen a lot of people just call and say like, yeah, this is great. We've tried to get into primary care in the area and it's been tough. We're glad you're here. And I'm new, so I got a lot of openings.
Yeah, yeah.
We've had people come out on their lunch break.
Yeah.
We've had people come like right after work, and I'm available pretty much any time. So that's great. And in Upland Hills is a good hospital.
Sure.
And it's a good backer for the clinic. So it's maybe a little bit better for older adults or anybody who doesn't really want to drive into Madison, find a parking spot. Upland Hills is a smaller hospital. It's 25 minutes down 151. It's one turn.
Yeah.
And there's one desk. You see one person, and then you get to see the doc pretty quick.
Right.
So it's
awesome.
It's a good experience.
Well, we have to take a short break, but we're going to talk with you a little bit more right after this. Stay tuned for more Wisconsin Doctors coming up right here. Hey folks, we're back here at Upland Hills Health, the clinic here in Mount Horeb, brand new, just built, just finished. And we've been talking with Dr. Joseph Berg, part of family medicine, and I just want to talk a little bit more because you mentioned you were from Onalaska, and we talked about where you did your residency. Talk a little bit about where you went to medical school.
Sure, I went to medical school in Des Moines, at Des Moines University. It's a little known medical school in Iowa. It's actually the largest medical school in Iowa. And has the largest number of primary care doctors coming out of it. It's also over 100 years old, so it's got a good history.
Wow.
It's a very good school. I really enjoyed my time there. I wanted to kind of get out of Wisconsin and explore more of the country, so I went to Iowa.
Sure, there you go. Right next door.
Yeah, exactly. So, yeah, that was my medical school. It was a great experience.
And Des Moines has a lot of different little colleges around town, I think. It's a pretty neat little area for those different types of universities. And I had no idea until you mentioned that Des Moines University was not only there, but offered a medical school and was old as it is.
It was old.
So that's pretty cool.
Yeah.
That's pretty cool.
Yeah, certainly.
Yeah.
Well, so tell me why you chose family medicine.
So I chose family medicine because I like people. When I was in college, I worked as a certified nurse's assistant, and I did home care in mostly older adults' homes. When I did that, I learned what it was like to really take care of someone and to really be appreciated for what you did, and that feeling is infectious. So wanted to continue that. So when I was thinking, I knew I wanted to be a doctor and go into medicine, and when I was looking at specialties, I found that primary care or family medicine was a place where I could get that type of experience in my everyday life.
Nice.
That's very cool.
Yeah.
I'm wondering, you've got all these different experiences that you bring to the table here, and we talked a little bit about, in our first segment, about the sort of difference between the experiences you got at Des Moines, working in Des Moines, and then working here. Talk to us a little bit more about that. Can you talk to us about, what are some specific examples of some things you might see, obviously without divulging, patient information and whatnot, about what some things you might see in Des Moines and how that can affect your the care that you give here in Mount Horeb?
Sure. For specific examples, in Des Moines, like I said, we were the only residents in a smaller hospital.
Sure.
We weren't associated with a big tertiary care center. So one thing we didn't have was specialty doctors. We didn't have cardiologists or gastroenterologists or nephrologists. We didn't have those people in the house. So if I had a really sick patient or somebody I had a question about, a lot of times I had to figure it out for myself or figure out where to send them to make sure that they had the best care. So it's actually helping me a lot. Here, because Upland Hills Health is a smaller community-based hospital, we are supported by a lot of the big hospitals in Madison, but the buck stops with us, and I think that the experiences I had in residency really helped me to be the doctor that's going to be good for this community.
It almost forced you to learn new things or step outside of where your area of expertise was.
Right.
And thus, I mean, obviously, anytime you do that, that makes you a better provider of care for folks. So that's awesome.
Yeah. What are the things that kind of concern you the most as far as like the health needs of our community?
I think I'm interested in healthcare policy and where we're going in the future in terms of access and how we're going to pay for things. And I think primary care is the most important thing in that future.
Right.
And what goes with that is preventative care, and it's very important to continue to stay up on things and to have a good primary care doctor.
Sure.
To make sure that those preventative visits and those preventative care things are addressed. For example, recently the U.S. Preventative Services Task Force, which is this big organization that deals with preventative medicine, recommended that women get mammograms at age 50 every other year. Now the American Cancer Society says age 40 every year. So you have to have a good discussion with your primary care doctor to say, what is the evidence for and against testing.
Sure.
And I think primary care will really help that.
Yeah, absolutely, absolutely. Well, so you've got some great ideas. You're a really interesting guy, and we've enjoyed talking with you. Can you give us? Yes, I'll shake your hand.
Yeah,
now.
sure.
Give us, what's one thing that you like to do in your spare time?
One thing?
Yeah.
I have a beautiful wife and a young daughter, and I love spending time with them.
Excellent. You're a family guy, family medicine. It's all in the family here.
All in the family.
Dr. Joseph Berg, thank you so much for joining us today.
Thank you.
Don't go away. When we come back, we'll be talking with Dr. Rachel Hartline. It's Wisconsin Doctors on CW 57. Hey folks, we're back with Wisconsin Doctors at the Mount Horeb Clinic of Upland Hills Health, and we're so excited to be here because the building is literally so new you can smell it. It just smells brand new, and we love it. And we're joined now by Dr. Rachel Hartline, who's also part of family medicine, or will be joining family medicine as I soon. Dr. Hartline, welcome to the program.
Thank you.
So obviously you're going to be joining Upland Hills very soon. When will you start, and when are you going to start to see patients?
Yeah, so some patients may have already seen me around a little bit. I've been taking calls since the springtime, kind of off and on. But I'll start seeing patients in the clinic on August 31st.
Okay, and have you been seeing patients in other places before then? Or?
I was finishing my residency in Baraboo.
Oh, okay, good. And that finished up well, and you're right there?
I'm well done, yeah.
Awesome, good.
Who will you be joining? Who's in the Spring Green Clinic?
Oh yeah, so I'm primarily at the Spring Green Clinic, and Dr. Miller is there, as well as Katie Poles, one of their nurse practitioners.
Spring Green, okay,
Yeah.
very cool, very cool. So talk to us a little bit about your residency in Baraboo. I mean, how long were you there for and stuff like that? Yeah,
so Baraboo is a rural training track, so we spend our first year in Madison actually, at the bigger hospitals, kind of getting a lot of volume and a lot of experience with more kind of, like the people you see in city hospitals.
Sure.
And that because, rural hospitals are totally a different environment.
Yeah.
And so in our second, third year, we spend all our time in Baraboo at the hospital there. And so we already know the specialists that we work with in Madison, but we're kind of used to working in a smaller hospital and used to the kind of the limits of what you may or may not have in that setting.
So you start at the bigger hospitals to get what you said, the volume, so you get as much experience as you possibly can, and then you kind of scale that down to get used to working in the rural setting, so that you're used to that when you come to a rural hospital. So that's awesome. Tell us about where you're from and where you went to school.
Yeah, so I grew up in Lynchburg, Virginia. It's kind of a city in the center of Virginia. I actually went to college there as well at Liberty University. And then I moved a few hours away to Eastern Virginia Medical School for my medical training. It's right on the coast. There's a beach very close. It's wonderful.
Very cool.
And then I made a big move to Wisconsin for residency, but I've enjoyed it. I'm staying put.
I'm just curious, what brought you to Wisconsin all the way from Virginia?
Yeah, so I was actually really interested in global health and kind of working outside of the United States. I love working in the United States, but I was interested in more training in that regard. And Madison has a great program in that.
Okay.
And so I was interested in that program, and then I discovered Baraboo, where is this place where you can kind of have the hospital to yourself and do all of the learning in a rural setting, but still have all the connections to the folks in Madison who who are doing really great sustainable work in global health, and so it was the perfect place for me.
Global health, very cool.
Yeah.
Why did you choose family medicine?
Oh my goodness, I couldn't find a part of medicine I didn't like. Yeah, I went through all of my rotations and I thought I like that, and I just didn't want to get rid of anything. And I also didn't want to see a patient I wasn't comfortable with. I want to still be able to see kids and adults and pregnant women and be able to care for all of those needs. So family medicine does it.
It sounds like there's just such a wide variety of things to do in terms of providing care for people in the area of family medicine.
Yeah.
So it's kind of like the smorgasbord then.
It is. I love it.
Yeah, that's awesome.
Never a dull day.
Right. So now, talk to us a little bit about your training down in Virginia, and then your experiences in working in healthcare, and both in your training and then in your residency.
Yeah. So my medical school was a really awesome school. It's kind of based with it was generated because the community needed more doctors, and so it's not affiliated with the university. They just founded this medical school because they needed more doctors in Hampton Roads, the kind of area of the state that we're in. But it was fairly urban, and family medicine, there's not a big culture of family medicine there. A lot of people go to specialists, and so I had decided that I wanted to kind of move out of that arena and be in a place where family medicine was more supported. So I moved to Wisconsin, and it has been very supported here. I feel like there's no one who said, oh, you shouldn't be doing this, because that's not the job of a family doctor, and that's something that I really value. So I've enjoyed it a lot.
That's very cool. And I like how you mentioned culture of family medicine. I guess I had no idea that there were places that didn't have that culture, where people are all about the specialists. Why do you think that is?
I don't, I think people get used to having what they have, and in a setting where there are a dozen doctors for you to see for anything, then it makes sense for you to probably see those things. But I want to work in the areas where people don't have all of those things available to them, and I want to provide services that they can, that they need.
Right. We got to take a short break here, but we're going to be back talking again with Dr. Rachel Hartline here at the Mount Horeb Clinic of Upland Hills Health. Stay tuned. Welcome back to Wisconsin Doctors, and we're here again on location at the Mount Horeb Clinic for Upland Hills Health. And we've been talking with Dr. Rachel Hartline, who's soon to join the Spring Green Clinic, the clinic up in Spring Green for Upland Hills Health. And I just want to kind of touch base with you again, because we talked a little bit about, with both yourself and Dr. Berg, we've been talking about, the differences between rural and urban healthcare and hospitals and clinics and so forth. So talk to us a little bit about what is it about rural healthcare specifically that motivates you to seek smaller rural communities to serve in?
Yeah, I really like taking care of the whole family, and I really like, knowing my patients. I think some people get intimidated by the idea of bumping into your patients at the grocery store, but to me that's really, ideal. I think it's a good thing. So
Sure. So you have a desire to truly be a part of the community, and
Absolutely.
this is not just a job where you come to work and then you want to go away from it.
Yeah,
So.
I don't think it's very fulfilling when you do it that way.
Sure,
So,
absolutely. Yeah, that's a good reason.
Along those lines, taking care of these families, there's a lot of issues. What are the issues that you care about most?
Yeah, I think one thing that's really under-recognized and underappreciated in rural communities specifically, and in particular maybe our community, is depression. I think that, when your mind is sort of in this dark place, then you have, everything feels worse, everything about your body doesn't seem like it's working very well. And I think rural people tend to be stoic and not want to admit that there are necessarily problems or that the stress in their life is taking a toll on their body. And so I think I want to encourage people to sort of not sweep that under the rug and not ignore it, because there are ways we can help with medicine and there are ways that we can help without medicine, but either one is much better than kind of continuing to suffer.
There's sort of this mentality of, life's hard, you got to work hard your whole life, you may not like it, but just suck it up.
Yeah.
I mean, that's kind of a Midwestern value, really.
Yeah.
But it's important that we pay attention as much to our mental health and our emotional health as we do our physical health, for
Yeah,
sure.
I think so.
Yeah. So obviously you have several different certifications. Can you talk to us a little bit about what those are?
Yeah, so we talked a little bit about, I went through a rural training track, and part of what What that offered me was the opportunity to pursue training in C-sections, which is an unusual thing for a family doctor, but I'm going to be performing those at Upland Hills. And the other thing that it afforded me the opportunity was a global health track kind of through the Madison portion of my program. So I spent a couple of weeks each year kind of in seminars learning more about both other cultures and kind of more diverse medicine in other settings. And while it won't be totally directly applicable to most of the patients I'll see here, I feel like it gives me a broader base just sort of to understand where people are coming from and how to work in kind of low resource settings. So.
Can you give us a really kind of brief description of what, or definition of what global health is? Like when you're studying global health, what is that?
Yeah, so it's a term that can be hard to define sometimes. The way I use it, I tend to mean medicine in settings outside the United States.
Okay.
But I think that there are pockets of diversity within the U.S. for sure, you know, and I think that the things that you learn in global health, that sort of term, apply in those settings as well.
So it's kind of applying different cultures to what we do already here in the U.S. as far as healthcare.
Yeah, that's part of it. And I also travel a fair amount doing kind of health in other settings. So I take a couple of weeks a year, and I think I'll continue to do that kind of in my post-residency practice. I take a couple of weeks a year, and most recently I've been to Kenya teaching nurses there to perform cervical cancer screenings, and so kind of providing healthcare in that way.
That's got to be an eye-opening experience.
Yeah,
things like that.
It certainly is, but it's really rewarding, and I think every life matters. Rural life matters, urban life matters,
yes.
Life matters in Africa.
Yes.
So.
Along those lines, what was your most maybe rewarding day?
Oh gosh, I had this day in my intern year where I was started the day in the ICU. I think I was living in Barab at the time, so I drove up from my rural place to the urban setting to care in the ICU, and there weren't a lot of patients, and I think we had a patient who, you can do a lot of things at the end of life, but sometimes it's people's time to go, and it was this person's time, and they passed away. And then I had my first continuity OB deliver in Baraboo, so I drove right back up the other way, and I had a birth at the end of the morning, and it was just, it's kind of the circle of life.
Isn't that interesting?
Yeah.
You get to see both ends of the spectrum. That's very interesting. It's very interesting. So I'm curious to know about you as a person. I think our viewers, obviously in Spring Green and in Mount Horeb, want to know about the folks that they're going to get to know hopefully very soon. Talk to us a little bit about what's your life outside of the clinic like?
Yeah, well, it should be no surprise to anyone probably at this point. I really love traveling.
Sure, right.
Yeah, I love traveling for medical reasons, but also for fun and seeing the world. And my husband shares that too. He is a farmer, and he studied international agriculture actually. So we like to travel together. And then we have a dog that we spend a fair amount of time with, and we take her on hikes sometimes. In the winter, I like to snowshoe.
Sure.
So,
yeah. Like to get outdoors and travel and get out there.
Yeah, and I like making stuff. My husband welds a fair amount, and sometimes I do little paintings on his weldings. So,
awesome. Well, Dr. Hartline, thank you so much for joining us today and for the
Thank
information. I'd like to thank both of my guests today, Dr. Joseph Berg and Dr. Rachel Hartline, both family medicine practitioners here at Upland Hills Health. Dr. Berg just recently joined here at the Mount Horeb Clinic, and Dr. Hartline will be joining the Spring Green Clinic very soon. Thank you so much for joining us today.
Thanks.
Thank you.
And from all of us here at Wisconsin Doctors and CW57, we invite you to live longer, live better. We'll see you next time.